Swadika, welcome to Asean Talks on Asean TV. I am Tulip Naksompop, your host in this episode. And today we're out on location again. On January 25th, there was a Prince Mahidol Award ceremonies at the Grand Palace. And today we have a chance to welcome the Mahidol Award laureates. We have with us Dr. Ruth F. Bishop, Professorial Fellow, Department of Pediatrics, University of Melbourne, Senior Principal Research Fellow, Murdoch Children Research Institute. สวัสดีค่ะ And we have Dr. David T. Wong, Adjunctive Professor, Neurobiology, Department of Psychiatry, Indiana University School of Medicine. สวัสดีค่ะ And also we have Dr. Paul M. Grant from the International CBT for Psychosis, which is a representative of Dr. Aaron T. Beck, Professor Emeritus of Psychiatry, University of Pennsylvania, Honorary President also of the Aaron T. Beck Psychopathology Research Center in Pennsylvania. First of all, thank you very much, all you three, to give me time. It's such an honor for me to have a chance to talk with you guys. So you were just received an award yesterday. What is the experience at the Grand Palace like yesterday? Anyone want to start first?
Very memorable. I don't think any of us will ever forget a moment of it. Colourful.
Colorful.
Exciting, beautifully organised, a great opportunity to meet the princess, who's a charming and very knowledgeable person.
How about you, Dr.?
I think it was spectacular to me, and also very moving ceremony, and feeling a touch of royalty.
Touch of royalty, okay.
Yeah.
It's something we don't have in the United States.
Oh, well.
Yeah, it's a very different experience, but
Yes.
it was certainly moving and really amazing.
Dr. Paul, I have to say, first when I received the information about the prize laureates this year, and I look at the date of birth of Professor Aaron T. Beck, and it's like, oh my God, he's 90 years old. Is he going to really come here? And I got all like, okay, I'm going to ask him, how is it the traveling experience? Because it's like over 20 hours flight to Bangkok.
No, 32 hours for us from where we live. Yeah.
Okay.
Yeah, 24 hours. It would have been 24 hours for Dr. Beck.
Yeah. You don't need to change flight. We have to change flight in two different locations. So.
Okay. It's like
Connecting
half
flight.
the world away, more than half the world away.
Yes.
Right.
Yeah. But you guys are here already, which is a great thing. Since all this award you received because of the great work you guys done, I would say for the world, I want to ask you what has been the inspiration to start off with starting this research in this field? What make you guys starting to focus on this in particular? Dr. Ruth, I would say is your field probably in the, am I right if I say child's pediatrics?
Yes.
Children's health?
Yes. Well, I think everyone starts from a problem, which has probably got a clinical basis. And as information accumulates about it, you begin to get to be able to formulate questions. And once you've got a question, you can set about trying to answer it. And I think the question in my case was what was causing severe gastroenteritis in many of the children who came into hospital. And that was my good fortune to be able to answer that question with the help of many colleagues and many clinicians.
Okay. I would say if you don't know yet, Dr. Ruth Bishop was a leading member of the team that discovered the human rotavirus. I call it correct, right? The virus claims about 500,000 children's lives every year, especially in low and lower middle income countries in Africa and Asia. So it's a very important discovery. And the vaccine that you also discovered has been widely accepted and used in more than 60 countries, including Thailand also. This vaccine has been saving lives and provide health care for millions of children. Thank you very much. And also, Dr. David, what made you start to get into neurobiology, right?
Yes. That is being inspired by the advances at the time in the early years of neuroscience. And led me to think that by studying the approach being developed at the time may be amenable for discovering of a medication to treat mental illness. And at the time that the neurotransmitter that fluoxetine focused on is called serotonin. At the time, the serotonin considered a putative neurotransmitter, means have not been truly confirmed its identity, physiological role as a neurotransmitter. And with the observation of several neurochemists, especially the one in Sweden, Dr. Eric Carlson's idea that serotonin may have to do with the enhancing mood with the drug that for treatment depression at the time. So that start the imagination that applying that the technology or the science at the time to develop fluoxetine.
Dr. David received the award for the outstanding contribution in the discovery of fluoxetine, or commercial name is Prozac.
Correct.
Or vitamin P. You just got it earlier. A lot of people were familiar with that name. And Dr. Paul, how is it like working with Dr. Aaron Tibet? Is he still working in the lab at the research center?
There's unequivocally, yes, he's very much still working. He retired from the university in the 1980s.
Okay.
At the time, he had what we call postdoctoral fellows, kind of the generals in the in the business. He had 4 of them. He has 10 now, and he's 90 now. And for example, the work he does with me is with schizophrenia, which are the people who perhaps have the worst mental illness of anyone. And some of the people we work with have been in the hospital for a very long time, and they've never really developed a normal life. And so we do a lot of hard work to try to improve their quality of life. So while Dr. Beck could not fly 24 hours to Thailand, he's busy in the trenches of Philadelphia right now, working away.
Very, very active. Very, very active, 90 years old. I would like to ask you guys also, what is your life outside the research center? What are the hobbies, interests? Or still research also?
Research is part of it. I think a major interest outside my research activities, of course, is my family. I had 3 children, and they have, amongst them, got 6 grandchildren, 5 grandsons and
Very
1
handful.
granddaughter. So, well, they're most enjoyable, and one does spend a lot of time with them. Apart from that, I guess I like reading. I like going to theatre and the opera and art galleries.
How about your daughter, David?
Actually, I also very much involved in the family life, and we have 3 sons, adult sons, of my wife and I, and about daughters. So we miss not having daughters, and but we have 6 grandchildren also, and we make up for it. Have 4 granddaughters, and just lovely, and the youngest one is 2 months old, so we look forward to spend time with the little boy. And so besides playing with our grandkids, and we travel. We love to travel when we physically get permit us to do so. So sometimes may not be as convenient because of the health, but whenever possible, we try to travel.
I was going to ask about traveling because I'm sure you guys have been in many places, many countries, in different kind of, I would say, state of each countries concerning medical fields and health and stuff. What do you see in the past 10 years has changed? Is it toward the positive change, a negative change? What would be the outstanding that you think it's worth mentioning or changing the world, or something inspiring you to keep working on this?
I think the inspiration to keep working is partly because it's not over yet. There are 2 very effective vaccines, but they're not widely available in developing countries. And so that's a task, I think, not entirely for scientists. It's very much a task for health administrators and government financial committees. But there is a great interest that we've discovered here. Thailand, I think, is about to start rotavirus vaccines, but there are a lot of countries, particularly in sub-Saharan Africa and in Southeast Asia, that still need rotavirus vaccines. So this is a task for, again, health administrators and governments largely.
How about you, Dr. David?
I was here 20 years ago to introduce
In
Prozac.
Thailand?
Introduced Prozac to the Bangkok hospitals and the drug in this country. And coming this time, and I have seen, I find that tremendous progress made. If not because of flood, I imagine that it's even much more different than what it was 20 years ago. At least I haven't seen some of the tall buildings in those days, but definitely. Another thing that I want to add is, besides traveling and playing with my grandkids, I still follow scientific literature, and it makes me feel that the science, in particular neuroscience and neurobiology, the progress has been tremendous the last 10 years, and make me to feel very happy that maybe even have better medication in the near future.
And I would say that I think that there's been a big growth of Dr. Beck's work, which is in cognitive behavioral therapy.
Mm-hmm.
I think in the last 20 years there's been enormous growth all over the world, and especially here in Thailand. There's really when we went out to the hospital, I was impressed at the professionals and their understanding of how to do it, and how telling me about the way they apply it to their patients.
Okay. I'm probably gonna later on will ask you a little bit about the Beck Institute. Yeah. But right now we'll take a little short break, but don't go anywhere. We'll come back and talk more. Welcome back to the program. You're watching ASEAN Talks on ASEAN TV, and still with us, the Prince Mahidol Award laureates, 3 of them, still here, of course. And before we take a break, we left off at the Beck Institute. Dr. Paul, can you tell us a little bit more about what the institution do? I know that you guys provide some training about the cognitive behavioral therapy too.
It's essentially it's the training arm of Dr. Beck's work. He set it up independent of a university. And at this point in time, it's very busy because cognitive therapy has really grown a lot in the last 20 years. It was founded about 20 years ago. And people, so if you go for a training there, you will find people from Africa, people from most of the countries of Asia, from South America. It's really quite impressive, the people coming from all over the world to learn about cognitive therapy. And it's got special workshops, so sometimes they focus on depression, they might focus on personality disorders, substance abuse, or even my specialty, which is schizophrenia.
Because I think cognitive behavioral therapists it will be different formulation for each patient, right? It will be like tailored to the condition.
Mm-hmm. Tailored to the condition and tailored to the person, actually. That's part of the beauty of it, actually, and one of Dr. Beck's genius, in a way.
Okay. Can I ask you guys, you have received so many awards, I'm sure, so far, and you have done so much work. What is your focus now? What are you concentrate on right now?
Well, I suppose my focus is still trying to support moves by paediatricians and others to get government agreement to finance and extend these schemes for universal vaccination. It's in place in Australia, but there are plenty of countries throughout the world that still need to initiate universal vaccination, and I would lend my support to any groups that are trying to do this.
You said the Nation newspaper, which is another English newspaper in Thailand, published some of your interview, and you said that you wanted researchers to keep working with children to keep disseminating information about their health problem to the public to encourage support for the issue to reduce child mortality, especially in developing countries. So that's also part of the...
Yes, yes, that's part of what I'm not trying to do on my own. There
Of
are
course,
plenty of other people
it's such a big
who-
job. We have
Yes,
to all
yes.
help each other.
It is a big job.
How about you, Dr. Wong?
Yes, I continue to serve on a consulting capacity for the United States National Institute of Mental Health and also the National Institute of Alcohol Abuse and Alcoholism. And both of these institutions interested in developing medication or help to promote the development of medication to facilitate because the pharmaceutical industry have perhaps a different objective. So they, these two institutes engage in sorting out what treatment should be developed and speed up the process. And so I've been doing the consultation. In fact, this morning I received an email that invite me to have another session of consulting the new treatment.
And what is Dr. Beck is doing right now?
I was telling you about that earlier. He's working on schizophrenia.
Okay,
That's his specialty.
as a main
Yeah, and so
Focus?
what he's doing is at a couple of levels. We've got a good way of thinking about it, sort of our theoretical approach to it, and then we've got a good therapy that we've developed, and then we've modified it so we can actually teach people in mental health hospitals to do it, so that because mental health hospitals are some of the places where people with schizophrenia don't do so well, so we're trying to improve the care there. Similarly, we're training people who are out in the community in the poorest parts of the United States how to do this treatment, how to help these folks have a better quality of life, and that's where I think Dr. Beck's passion is right now.
Can I ask you guys how important it is from each country to get support from the government, and how big effect at all, if there is any at all, the politics has in play when in terms of medical research, or you're trying to get in and expand the words or create more awareness about all these health issues?
Well, I think government support is critical to use of a vaccine because they're the money bags, if you like. They're going to pay for it. The other level of support that, or initiative that is critical is that the paediatricians in Australia were, I guess, approaching politicians, local members, the central government itself, the Northern Territory in Australia, which has quite a considerably large Aboriginal population where gastroenteritis and rotavirus infection is a bigger problem than in the other states. They made a unilateral decision, the government in the Northern Territory, to start universal rotavirus vaccine in the Northern Territory before the rest of Australia did. So that's an illustration of how critical it is to get both clinical, paediatric support and government support.
It will make it become more like a force with the government support.
Yes, and once they see the benefits, the success of the universal program, and it also decreases their healthcare costs because children are not having to go into hospital
It's a preventive
any longer,
measure.
I think they begin to see that they've done the right thing in many ways.
How about you, Doctor?
Yes, in the United States, the last 20 years, there's a lot of small biotech companies sprung up, and many those companies come up new ideas, but they are small companies. Funding is very limited. And so in order to develop new medication, require quite a bit investment. So the government comes in and help to identify that. That's where I played the role. Able to identify which therapeutic treatment would be one that preferred to be selected for further study, and so the government would help to facilitate the initial, at least the initial clinical study of the new molecules, whether may or may not be efficacious. But after the preliminary early phase of clinical efficacy identify for a molecule, and then they allow the companies come back and take over to further develop. Then the company will have resources, other investors would go in to help them to further develop their drugs. So I think that the government had that role, how to facilitate the development of new medications.
Okay.
Maybe there's another side to it. I'm not sure how it works here, but for some of the things that I do, I mean, we have the federal government, right? You have then we have state governments, and then we have local governments. And it turns out for some of the stuff that getting treatments out to the poorest people, it turns out it's the state government and the city government that can be rather key. And so some of the work that I'm doing actually is funded by the city and state governments.
Smaller units.
Yeah, because they're the ones that actually pay most of the cost for the severe patients anyway. And so it's exactly what Dr. Ruth said. It's really about them learning that if you get better treatments, there are less encounters with health professionals, and they save money. But they've got to invest in treatments that work.
Okay.
So that would be. So I think they have a big role to play in that. We can't do that on our own.
Maybe I will go a little out of the subject a little bit here, but since you guys from America, can I ask you about what is your opinion?
Australia.
Can I ask you for your opinion about the universal health care in America? Do you think it's going to be a good thing for?
I think the model that we heard this morning after Dr. Bishop's keynote speaking, and I thought it was very impressive progress made and initiated by the government here. And, however, that had not been publicly known, and so it would be good that other countries are aware of what's going on here.
Right, right.
I was just going to say, I agree with Dr. Wong. I was very impressed with the presentation this morning. And one thing that I think you really see in the United States, that I think you see much less of when I've traveled in Europe, for example, is we have a lot of very poor people who aren't getting health care. And you go to parts of the United States, and they're as poor as some of the poorest parts of the world. The folks don't have health care, and all the problems that you're describing with the lack of health care show up. So I was also very impressed by what was presented today, and I agree with Dr. Wong. Nobody in America knows about it. They see universal health care in a very negative light for the most part. There's a political word that gets branded as socialism, which has somehow become a very bad word. But nonetheless, I think the outcome speaks for itself.
Okay, I have only 2 minutes left, but as the veteran and very respectful person in industry, can you guys, do you guys have anything to say for the young medical personnel and healthcare that what should be looking for in the next century or future coming forward in that generation? What is the thing that you worry most? Okay, that sounds like a lot.
That's not a 2-minute answer.
I'm sorry, I'm not quite sure whether you're asking me what
anything you want to say for the next
people's
generation.
motivations would be, or what ideally I would like solved by young people, which is a bit different.
Maybe both.
Well, I think a solution to HIV is would have to be top priority in my view. In terms of young people's priorities, I think they should experience as much of medicine as they can and then select what appeals to them. Medicine is a very broad church, and in it you can find something that satisfies anybody, be they mechanical people who like using instruments, and others who like talking to patients, and others who like looking after babies. There's an enormous variety of specialisation within medicine, and just remain open to what appeals to them.
Dr. David, anything you want to say to the younger researcher and medical personnel, the next generation of the industry?
I think that the Prince Mahidol Award Foundation really have the vision in developing young people in healthcare, and not only look at healthcare as a responsibility to the people, but also invest in young people in medical science, and for them to pursue further understanding of the diseases. And that's my impression that many future breakthrough of science would come from Thailand.
Okay. That's the pressure.
Well, I guess from my perspective on things, I would say, I think from the young folks I've met who are going into medicine, they're very interested in genetics, they're very interested in a lot of the really sophisticated technology, and I think all of that stuff is fantastic. The only thing I would add to it is I would hope they would also be focused on behavior. You've got a lot still to learn at just a basic behavioral level, and these things fit together. You can't entirely solve it just with a small thing, so behavior, and also groups and things like that, some of the stuff we heard about here, sort of all that kind of stuff.
Okay. Well, that's all the time I have in this show, but I feel very honored to have you guys on the show, believe it or not. I'm really excited that I get to interview you guys, and I think your work is really important, and thank you so much.
Let me add what Dr. Grant
Yes!
finished saying.
last
that the biology, and because of the new technology of brain imaging, have beginning to put what Dr. Grant and Dr. Aaron Beck doing, with beginning to merge with the therapeutic agents, the action of therapeutic agent, and so beginning to appreciate what brain area involved in illness, and also what area able to make the treatment. So I think that development would open up new avenue to treat mental illness. Hope that the young people here would be able to capture that aspect.
A lot more to go.
Yes.
And pressure on Thailand.
Pressure's never too bad. It's a good thing.
Pressure is never too bad, yes. It's a good thing. Well, thank you very much today. Thank you for your time. And I hope you guys had a pleasant stay, and you're going to leave in 2-3 days? Yes?
Yeah.
I hope you guys
Go
had
home Saturday.
home Saturday. Okay. Wish you guys have a very great, good flight back. Thank you very much. Thank you. And that's the Prince Mahidol Award laureates of the year 2011. I hope you guys enjoy the interview, because I do. And until I see you next time, สวัสดีค่ะ